Hello, I'm Amy Fowler, owner and care manager with W&C Geriatric Care Management. I work with a lot of families who are looking for options for their folks or loved one at home. And they often ask me, what do I really need to know before I hire someone to come into my house? Well, there's some simple things that we can discuss today that will help you make sure that you hire the right people for your loved one. First of all, it's important to know that there are 3 different types of non-medical home care. That's what we're going to be discussing today. There's companion, which includes socialization, assistance with tasks around the house, taking folks to the movies, really companionship. There's homemaking, which includes exactly what it says, light housekeeping, meal prep, shopping, running errands. And the 3rd level of care is personal care. That's more hands-on. The medication reminders, assistance, physical assistance with transfer and ambulation, personal hygiene, including bathing. So when you're working with an agency or an individual, you need to be clear on what type of, what level of service you are wanting for your loved one. Understand that agencies typically have a minimum number of hours that they require you to use that individual. You're not able to call someone in for an hour of service. That's not worth it to them as a business owner. Typically the minimum is 3 to 4 hours. You need to ask the question if nights and weekends are more expensive. Some agencies are, some aren't. You also need to ask if the caregivers are insured and bonded. That makes sure if something happens and something is stolen that they're going to help cover that cost for you. Now, I've talked a whole lot about agencies and what agencies can provide. There are certainly individuals who are private caregivers, and oftentimes that can be a really good fit for your family. They're not minimum hours needed, the price is cheaper because you're not going through a larger organization, but you need to understand and keep in mind that that individual needs to make sure they have backup. If they are sick or it snows or they have an emergency, is there someone who's going to cover for them? So you need to keep that in mind. Non-medical home care is completely private pay. Now, some long-term care insurance policies will reimburse you for those dollars that you spend, but this is not something that Medicare will pay for or any of your other insurance providers. It is something that comes completely out of your pocket. If you decide to use a non-agency caregiver, always ask for a reference of a previous and future client that they're working with, so you can get the good, the bad, and the ugly information from other people to make sure that they're the right fit for your family.